Welcome to the launch of the Keep Breathing campaign organised by the European Lung Health Group with the support of the MEP Lung Health Group. During the next hour, we're going to be discussing why the often overlooked issue of respiratory disease in Europe needs urgent attention, and particularly in view of the upcoming European elections. Let me just quickly introduce myself. My name is Anya Sitharam. I'm a former health correspondent and a former BBC World News presenter, and I now moderate panels on health policy like this. In the EU, 1 in 8 deaths are caused by lung diseases, and the numbers are rising. While the COVID-19 pandemic has pushed the EU and member states towards more coordinated action on health, campaigners say the approach to lung health is still very fragmented. Today, the European Lung Health Group, with the support of the MEP Lung Health Group, is hosting the presentation of a new publication, Keep Breathing, a vision for EU action on lung health 2024 to 2029. It's now available online at the website breathevision.eu, and you'll hear more about the main pillars of action during the next hour. We'll be hearing from the European Respiratory Society and the European Federation of Allergy and Airways Diseases Patients Associations, who will be presenting on the current situation of lung health in Europe, as well as having a panel discussion with health champion MEPs on the opportunities for better lung health in Europe. And we'll be inviting you to ask questions via Slido. You may find the QR code on the screen or go to slido.com and enter the code 2959511. I'd now like to invite MEP Tomislav Sokol, Croatia EPP, and co-chair of the MEP Lung Health Group, to make some opening remarks. I'm just told that he is a little bit late, so he'll be coming soon. So we're going to hear first from the representatives from the European Lung Health Group. Eva Polverino from the European Respiratory Society, ERS, and Marcia Podesta, the European Federation of Allergy and Airways Diseases Patients Association, AFA. But first, I give the floor to Eva Polverino.
Good afternoon, Anya, and everybody. Thanks for the opportunity. So can I see my slides, please? Yeah. Okay, good. I think we have it. Okay, good. So can you see the slide, right? Give me a second because I'm trying to take the control. Yeah. So let me see whether I can. I'm clicking on the slide, but I cannot take the control of it. Something is wrong. Can I ask maybe somebody to take the control of it, and I'll ask you to keep. Yeah. Yes, I will ask for the next slide. So as just said, I'm Eva Polverino from the European Respiratory Society, and we'll try to cover this this topic about the respiratory diseases in this context of the European Union. Okay, can you show the next slide, please? Yes, where are we now? So it's a simple table to show you the most important numbers about respiratory diseases. So you see here represented the most common and most relevant respiratory diseases. As you can imagine, asthma, COPD, lung cancer, respiratory infections, tuberculosis, and interstitial lung diseases. What you see here are impressive numbers about their burden. That is about 88 million deaths caused by this disease, over 1 million deaths, and health years lost, 27 million. So if you put everything together, in 2019, the European Union calculated that these conditions were responsible for an overall societal cost of more than 4,000 billion. So impressive. And these numbers justify what Anya just said at the beginning. 1 in 8 deaths in European Union are related to respiratory diseases. Next, please. So what I would like to show you is this long list of chronic conditions that are able to cause disease in Europe, right? So you see a list. Next, please. What you see is the cardiovascular disease as expected is always the first one in the ranking, but you can also identify respiratory infections and respiratory chronic diseases to be responsible for 6 and 4% of all these conditions. Then altogether, next, please, mean 10%. Okay, of disability adjusted life years in terms of ranking. So just after cardiovascular disease in the second position, we could put all together the respiratory diseases, an impressive burden, as you can imagine. Next one, please. So what I want you to know today, Europe is becoming older. What does it mean in terms of lung health? That is what we're talking about today. Let's see the next one, please. An aging population means that a greater proportion of the population will suffer some conditions that are related to aging, like cancer. You see on the left side that with aging, the risk of cancer becomes higher and higher. But not only that, you can also see that COPD and asthma, the most common respiratory diseases, become more and more frequent with aging. Next one, please. And not only this, we talked about infections, and you see that the incidence of pneumonia and the number of deaths due to pneumonia become extremely high over the age of 60. And this is also related, unfortunately, today to the credible risk of dying because of antimicrobial resistance that has been declared by the WHO as one of the major threats for the humanity. Next one, please. I have another point for you today, that is what pollution and climate crisis can, what kind of effect they can have on our lungs in Europe. Let's see the next, please. So as you can imagine, we are simply changing the rules in our planet. We are having an impact on air, water, soil, and not only because of climate change, but also because of increasing air pollution and because of increasing poverty. All these have an impact on all kinds of life species, from viruses to plants, human beings, everything. Next one, please. So what you see that even before the pandemics, we identified that climate crisis was generating the emergence of new viruses. And between these, obviously, also the SARS-CoV-2 virus. But this was had been said years before the beginning of the pandemic. So we have new viruses because of climate change. The temperature is changing. Next one, please. But climate crisis is also causing a number of other effects because this environment is favoring infection transmission and spread as well. But also our immune system in these conditions is less prepared to get rid of the infection, to defend ourselves from any kind of infection. And this also favors the antimicrobial resistance, the impact of that on the management of infection. All this means worsening in all chronic diseases, from allergy to asthma, COPD, cancer. And unfortunately, this also goes with the risk of reduced access to care. Next one. Next. One before. So just to show you, this is not irreversible. There is a nice paper showing that if we are able to reduce air pollution, we can improve lung health. This was done on a long set of children from the age of 8 years old up to the age of 24. And by reducing air pollution, lung function was improved. So this is reversible. There is a lot we can do on that. Next, please. So what is the story today? Lung health. Next. Unfortunately, we know the burden of respiratory disease is increasing because of aging, because of climate changes, because of pollution, and also because of the risk of pandemics that is so clear to us, everybody. At the same time, next, please. Unfortunately, there is a reduced budget for research, for prevention, for care. So where are we now? Next, please. This makes not so much sense, am I right? So the last slide, please. The last two. So this is the situation today. This is the budget we have that has been invested for health between 2021 and 2027. So you see that we have 5 million euro for chronic respiratory disease. That is 0.1% of the overall budget. So considering that, next one, do you think this is proportional? I don't think so. In addition to that, you know, the European Council decided to cut €1 billion from this budget. So please think of the impressive burden of this disease on the society. So I think there is a big disproportion between what is the cost. Look at this number, over 400 billion for the 7 major lung diseases, and what we are investing in for research and care in this. So to me, it is a political priority to work on this and do our best to improve the situation. And that's all from my side.
Thank you very much, Eva, for that very informative presentation, particularly highlighting the burden of lung diseases and the challenges faced by climate change and by antimicrobial resistance. Those are indeed the challenges of our time. And of course, the limited budget that is being used at the moment to deal with these problems. But as you say, the problem is not irreversible. There is hope, providing there is a political priority. I would now like to invite Marcia Podesta from IFA to give your thoughts. Marcia, the floor is yours.
Thank you, Anya, and many thanks to Eva for highlighting the issue of resources. Patients witness a clear mismatch between the importance of preserving lung health and the cuts on the budget to achieve the European Health Union. The resources are far from reaching the ambition. Lung health, both prevention and care, requires attention and investment. I represent patients with asthma and chronic respiratory diseases, and in this event, I am delighted to see many patients and healthcare professionals following what the members of the European Parliament want to say about respiratory diseases. Together, we form the European Lung Health Group. We are 9 civil society organizations. We are non-profit. We live with respiratory diseases or treat it, and we are very worried about the lung health deteriorating. After the pandemic that we have just been through, lung health needs to be reinforced. The EU has stepped up the section on public health, reinforcing surveillance of respiratory pathogens, promoting cooperation in healthcare, and even proposing the pioneering European health data space. However, these initiatives alone will not solve the health and care challenges we are facing today. 9 in 10 Europeans consider respiratory diseases to be a serious problem in their country. That is enough of a signal for more targeted, collaborative, and resourced action on lung health at EU and national levels. European patients I represent are looking at the European elections as an opportunity to put lung health in their agenda and address unmet needs. They need to keep breathing and to do it safely. We need action on lung health that is up to the challenge. The cuts in the EU for health budget announced in February go in the opposite direction and don't match the 422 billion euros that costs annually respiratory disease in Europe. There are 3 main areas of EU action that could ensure better lung health for all in the medium and long term. Firstly, policies that protect lung health. Air pollution alone causes around 400,000 premature deaths in Europe annually, with respiratory diseases being major contributors. Yet the efforts to improve air quality standards don't align with scientific recommendations. The European Environment Agency sadly reports 1,200 children a year die from air pollution in Europe. And these diseases can be prevented by legislation, especially in light of threat of climate change to health. Europe is the fastest warming continent in the world. Secondly, policies that improve care for respiratory diseases. Lung health and care doesn't just happen at a consultation. Therefore, the European health data space needs to be people-centered, drive health literacy, and patient empowerment. Likewise, EU incentives shouldn't just be attracting new molecules, but also encourage efforts toward early diagnosis, multidisciplinary care, and long-term care. Lastly, boosting research for respiratory diseases. Most respiratory diseases don't have a cure, and they are complex to treat and to manage. They require public and private partnerships to allow research to evolve. Only the EU, with all its network of researchers and innovators, can move the cursor towards a solution for respiratory disease. The lung health community has a vision for people in which people are healthier, health systems are resilient, and societies are better prepared for crisis. Thank you very much for your attention, and please remember, our policy is to keep breathing what's yours. I look forward to hearing from the members of the European Parliament on how we can improve lung health together.
Thank you very much, Marcia, and we will be hearing from the MEPs very soon. And thank you very much for your insights into the opportunities for better lung health in the light of the upcoming elections. I would now like to invite Tomislav Sokol, Croatia EPP, co-chair of the MEP Lung Health Group, to make some very brief opening remarks. Mr. Sokol has played a key role in developing EU health legislation, having been on the European Parliament's negotiator on the proposal for a European health data space, as well as leading his party in the negotiations on the revision of the pharmaceutical regulation. So, Mr. Sokol, some very brief opening remarks, please. The floor is yours.
Thank you very much. Thank you for reaching out to organize this event. I think it is very timely because since we adopted Europe's Beating Cancer plan, beating cancer has become one of the most important topics here in the European Parliament and in European institutions in general. However, we are losing this momentum, and unfortunately, this is also seen in these budgetary cuts that have been adopted by the European Council, which is very unfortunate. After adopting Europe's Beating Cancer plan, which was the first really strategic, systematic European strategy on beating cancer, which includes concrete targets, objectives, benchmarks, and funding, we really made some progress in a lot of areas. Unfortunately, we could have done much better on lung cancer, I have to say. So definitely there is room for improvement there on lung cancer. Some other things have unfortunately been more prioritized, but definitely we want to improve lung cancer, if we want to invest more into screening, if we want to invest more into research on lung cancer, we definitely need stronger funding. So definitely I will fight, do whatever we can to return this funding that has been taken, let's say, from EU for Health program because of the MFF revision and the need to help Ukraine. We can do a lot on lung cancer European level. So apart from promoting and co-funding screening on the national level, investing into research, for instance, beating cancer has become one of the priority missions of Horizon, but we definitely need much more investment. We can also do a lot in terms of legislation. So in terms of legislation, for instance, on smoking, on environmental legislation that has already been mentioned. So EU has a really big role to play in terms of actually prevention, which and making our living conditions much healthier, which directly affects lung diseases, and of course, obviously, the big importance of fighting and reducing smoking as much as possible as one of the leading causes of lung cancer in the European Union. Also on the European Health Data data space, we are currently in the final phases of the negotiations. This is something which is very valuable. I think if we get this right, this can really be a game changer in terms of improving access to healthcare, especially for patients who are traveling across borders in the EU, who will have all of their health records in a digital common European format. So it will be accessed by healthcare professionals in any member state, which will make it possible to receive treatment much faster and in a much more efficient way. But also it will help research, because it will open up large amounts of data sets which are now lying around unused. It could be used for research, for innovation, for developing new medicines and new medical technologies to tackle lung cancer. So a lot of things can be done on the European level, both in terms of improving and adopting new legislation, especially on prevention, but also in terms of funding research, in terms of funding lung cancer screening programs. We need stronger budget, and I will be fighting for that in the coming years.
Thank you very much, Tomislav. We're going to go on to our panel discussion very shortly, but I just thought I'd tell the audience that it's 13:20, and without realizing it, we've all taken around 400 breaths, and that's based on the calculation that we take approximately 20 breaths per minute. So we need to breathe just to be here, and it just shows how important being able to breathe and good respiratory conditions are. So let me just tell the audience as well, if you're just joining, we would appreciate your questions on Slido. So you can either scan the QR code or go to slido.com and enter the code 2959511. So we're going to have our panel discussion now. We've seen Tomislav Sokol, and the other two members of the panel discussion are active members of the European Parliament and the EP Subcommittee on Public Health, SONT Committee, and they've contributed to key health issues. So we're joined again by MEP Tomislav Sokol, Croatia EPP, MEP Radka Maxova, welcome, she's from Czechia SND, and also MEP Stelios Kimporopoulos from Greece EP. Welcome to you all. Tomislav, I just wanted to pick up some of the points you were making earlier, because you sound very positive. A lot of people are very worried about the EU's decision to reallocate €1 billion from the EU4 health budget to support Ukraine. Do you not think that'll have a detrimental impact on Europe's lung health?
It seems that I was misunderstood. I said that this is a major problem, but I said that we have to fight to get this funding back as soon as possible. So maybe I wasn't clear enough. So what we had in terms of budget cuts is a 20% decrease in EU4 health program, and this definitely will not have a positive impact on all the activities that have been mentioned. Not to mention the fact that only really a small percentage, as you said, is dedicated to lung cancer. So I said, but maybe I wasn't clear enough, is that we need more investments into cancer, fighting cancer in general, into research, into cancer screening programs, especially lung cancer screening. We will also have a lot of investments which will be necessary for implementation of European health data space, building the digital infrastructure for the exchange of health and the use of health data that is needed. So definitely we will need more funding, and I will, as I said in the last part of my introduction, I will strongly fight to get this money back as soon as possible. Lung cancer and lung diseases are one of the biggest health problems in the European Union, causing 1 out of 8 deaths in Europe. So this is something that definitely we have to become a much stronger priority than it has been up until now. So definitely, I do not see this budgetary cut of almost 20% as a positive thing for health, and we will definitely have to keep fighting to get this funding back as soon as possible. On the other hand, we also have, I also said that we have a lot of other activities which of course need to be funded, but not just financial activities, but we can do a lot in terms of legislation. For instance, adoption of European health data space, new legislation on smoking, environmental legislation relating to pollution and other things. So some of these things have already been done, but some of the things, like for instance, relating legislation on smoke on tobacco has been postponed or delayed throughout this whole mandate, because you know that we cannot propose legislations on our own, the MEPs, but we are dependent there on the European Commission. And we've been waiting for a long time for the Commission to propose legislation on the revision of legislation on tobacco, but this has still not happened. Probably this will happen in the next mandate. So as I said, there is a lot of initiatives going on. Unfortunately, lung cancer has definitely not been one of the priorities. We have to change that. We will have to fight for increase in budget, but we also will have to work on the new legislation which directly affects lung cancer and lung diseases as well.
Thank you very much for clarifying that, and my apologies if I misheard you. Another question for you then, because there are 9 main and divergent policy areas which deal with lung health at EU level, showing how cross-cutting respiratory well-being is. But it also means policy is fragmented. So how do you think EU policies can be better coordinated?
Yeah, that's a major issue. That's a big problem in many EU policies, because especially there are always cost-cutting issues. For instance, the rules on common market, and people who are in charge of common market in the Commission not always communicate well with people who are in charge of health, who are in charge of environment as well. So I believe that definitely we need better coordination. We've been pushing the Commission a lot on these issues. Some new agencies have been formed, but definitely within the Commission, a lot of things need to be done. But our impact on that from the Parliament is pretty limited. So we can push the Commission, we can ask them questions, etc. But in the end, they will be the ones to decide how best they coordinate internally. What we can do in European Parliament, and I think this will be very important, is to give more priority to health in general. Because currently, you know that we have the same committee in the Parliament which is in charge for both environment and health. And in that case, unfortunately, because of this and the importance of environmental policy in the last years, health has become definitely a secondary issue there. So what we will be pushing for, my political group and me myself, that in the next mandate, we don't have a subcommittee on health that we have now with limited competences, but that we have a really fully fledged separate health committee with full legislative powers, and by doing that we'll be able to coordinate all European Parliament's initiatives on health within one committee, and this will definitely raise the profile of health in general in the European Parliament, but also the question of lung health as well. Also what we need is to strengthen and revise the implementation of Europe's Beating Cancer Plan, see what we can also do there, and we are constantly engaging the Commission on this, and we will continue to do this in the last mandate, because now there have been several years of implementation of Europe's Beating Cancer Plan, and I believe that we actually have to pause a little and see what has actually been done and what can be done better. So in that sense, also, I think there is a big potential to actually coordinate more all of these initiatives relating to cancer, including those relating to lung cancer. On other issues, as I said, we cannot do everything right, but in terms of better coordination within our house, better control of what the Commission is doing, stronger pressure on the Commission to coordinate more rules on lung health, I think that we can definitely do much more than it's been done up until now.
Thank you so much, Tomislav Sokol, for your intervention and your insights there. Thank you so much. And I know you have to go on to another.
And maybe if I can just add one thing, sorry, if just 1 second, I would just like to reiterate again the importance of European health data space, because apart from gathering and systematizing data related for the purposes of research and innovation, also policy decision making could benefit a lot from the European health data space. So we will be able to get much more data from all member states, but also to compare this data, because we will have common standards on how this data has been gathered, and this can definitely influence a lot the way how we make policy decisions. So this is something which is also extremely important, but also what is very important to also bring all the stakeholders in a much stronger way. I've been advocating strongly that three crucial groups of stakeholders: the industry, the healthcare professionals, and the patient groups, patient associations, take part much strongly in the policy-making framework of European Union. Unfortunately, I was not completely successful in the European health data space, because some other political groups in the parliament opposed this, because I wanted, for instance, for patient groups to have a fully fledged seat in the, for instance, European health data space board, which should be developing guidelines and control how this whole process of creating European health data space is working. Unfortunately, this was not supported by the majority of political groups in the parliament, but I will continue to work on much stronger engagement of all stakeholder groups within the policy making. And I'm also in the area of pharma that you mentioned, that I'm the EPP shadow rapporteur on the revision of pharmaceutical legislation. I will be also fighting for even stronger voice for patient groups and stakeholders within the framework of European Medicines Agency. So I think that by promoting stakeholder engagement, we can do much more in terms of better coordination.
Thank you so much. So better coordination there. Thank you very much. And thank you very much for coming to the meeting. I know you have to move on to another urgent meeting this afternoon. I'd very much like to bring in our two other MEPs. And first of all, I'd like to ask MEP Stelios Kimpouropoulos, I'd like to know your reaction, please, to the cut from the EU4Health budget and the impact you think it'll have on lung health.
Anya, thank you a lot for your question, and I totally agree with you that the lungs are so important for life, are very essential for our life. You mentioned how many breaths we take. Each breath fuels our existence, and yet the lung diseases persist as silent killers, and we need not to focus only on one disease. We need to see the whole spectrum of diseases, especially asthma, another disease, tuberculosis, which is away from us but still persists its existence. So we have many other issues, COPD. We have many other issues, and we need to see as a whole how we need to protect our lungs. And prevention, I think, is the key. Regarding your question, yes, it's absolutely the wrong direction when we reduce the fund in EU4Health. We need to stand up, and we make the discussions, and we have to do the collaboration in order to see, especially in next mandate, how we can not only increase to 20%, but to increase furthermore to see results in the area of research and innovation. I think that as members of European Parliament, we must pave the way for a future on the research, especially on the lung, and how we can see results on quality of air, on prevention, on care, but also a very important issue, and the results will be tremendous if we establish a right climate change regarding if we follow the Green Deal. We need to see how climate change is affecting human health by exacerbating existing respiratory conditions. And we need to see how we reduce the exposed substances and how they affect. We know, but we need to avoid these substances which affect the health of the lungs. So we need to focus on the research. We need to focus on a good funding area.
Thank you very much for your suggestions and your intervention. I'll come back to you in a minute, but I would very much like to ask MEP Radka Maxova, who's been waiting patiently. Welcome to you. The COVID-19 pandemic exposed the limits of Europe's healthcare systems, as well as brought the seriousness of respiratory disease to the front and center of public attention. So why and how can the lung health be a priority for the EU from now on?
Thank you very much for your invitation and question. Is very important because lung health, in my view, should be a priority of EU for several reasons. It is building resilience, economic impact, quality of life, health inequalities, environment concerns, and last but not least, preventive measures. For example, building resilience, it means that the COVID-19 pandemic highlighted very strong vulnerability of population to respiration diseases. And therefore, we should prioritizing lung health. It would be enhance the ability of healthcare system to respond effectively to future respiratory challenges, improving overall public health resilience. We can see also economic impact. Respiratory diseases we could see in presentation, including very affected lungs, can have a significant economic impact to the healthcare cost, lost productivity, and stray also very strong on social system. Also, it is linked with quality of life. Therefore, prioritizing lung healthcare can improve the well-being of citizens by preventing and managing respiratory conditions. And also, it can allowing people to lead healthier and more active lives. It could be better quality of life. Inequalities in health or health inequalities we could see also during pandemic COVID-19. This pandemic highlighted existing health inequalities between European countries. Therefore, prioritizing lung health can contribute to addressing these disparities and that vulnerable populations receive adequate attention and support, and maybe we could have one healthcare policy in European Union, or European Union should have more responsibility in this area, or some joint action in the field of healthcare. Also, it is linked with environmental concerns because addressing lung health can involve policies and initiatives aimed at improving air quality and reducing environmental factors. We very strong discuss here Green Deal, and it is also linked with health and lung health of our population. And last but not least, very important preventive measures. Focusing on lung health allows for a strong emphasis on preventive measures, including vaccination programs, public health campaign, and very important early detection of respiratory condition. These reasons can save a lot of money if we do everything what I said. I know it is difficult, but in summary, prioritizing health, lung health in EU is, I think, crucial for building a resilient, equitable, and sustainable healthcare system that can effectively address current and future challenges in respiratory health, ultimately leading to improve overall well-being for European citizens.
Thank you very much. And you mentioned there, you were talking about prevention, which is one of the important pillars that the Lung Health Group has advocated. So better prevention, care, and also research and innovation. Stelios, I'd like to come back to you. You mentioned briefly climate change in your first comment. I just wanted to go into that a bit further because climate change is hitting Europe and it impacts health in every heat wave, wildfire, and thunderstorm. So are we actually ready to protect lung health from the impacts of climate change?
Sorry, the microphone was mute. So we have to be ready. Otherwise, I'm afraid that we will have other difficulties regarding our health, because there is an absolute link between the climate and how we behave to climate and how it is climate, the environment is protective, and our health, and especially lung condition. So it's well known that extreme weather events can impact the quality of the air and contribute to worsening respiratory issues that can become chronic, but also lethal. I think that reducing carbon emission in line with Green Deal is the perfect moment to prevent climate disasters that exacerbate lung disease, such as you said, heat waves and wildfires. So I think that we are in the right direction. We need to also contribute to this direction, such as the reducing of fluorinated gases from let's say MDIs. As you know, I was a shadow rapporteur on the revision of the fluorinated gases regulation. It is important to protect and to go into and to dip into next generation products with a good protection of substances that to avoid substances which affect our health. And fluorinate is something that fluorine gases is something that influences the environment. So with our key text on the revision, we took into considerations the requirements necessary to make a smooth transitions for the patients, always respecting their needs. Protection of the environment, but also to move to new generations treatments with the safety of patients. This is a good combination for the future.
Thank you. Thank you very much. I'd like to ask you a couple of questions coming in from the audience. So the responsibility for care lies mainly with the member states. The figures for funding versus prevalence are striking. So what role can the EU play in moving towards national lung health plans, integrating prevention, care, and research? Stelios, if you'd like to go first, and then Radka after that.
I think that we need to create plans not only on national level, but also across Europe, with reducing inequalities in access. And we should encourage member states to adopt a life course immunization approach, empowering people to self-manage. So I think that we have both directions. First of all, to educate people on national but also European level, but also to create the right legislation which support people in order to go in an easy way to self management, to self protection, and to improve the prevention for everybody, with legislation, with creating the national strategy regarding lung health.
Thank you. Radka, other questions coming in, and many questions coming in that we try to answer. Do you know which health areas will be impacted by the cut for the EU for health budget, or can you anticipate?
I hope that no, because as my colleague said, we try to change mind of European Commission to take so many money from EU health budget. So I hope that we try to change mind of European Commission. So I can say it now exactly, but if we don't manage this our fight, then I would like to say that it should be divided the same way for all sectors in healthcare. But finger crossed, I hope.
Do you know why the EU would choose health to reallocate the budget?
I don't really know now. I try to find where or who came with this idea to take money for healthcare, and then we will push for changing.
Thank you. So to go back to the question I asked Stelios, what role can the EU play in moving towards national lung health plan? Radka, just that's a question for you. What role can the EU play in moving towards national lung health plans, integrating prevention, care, and also research?
It is a really difficult question because, as we know, the responsibility for care, for health, for education, for social things are responsibility for member states. Yes. And as we could see during COVID pandemic that if we go together, if we take a common decision, we are stronger. And also people call for stronger competencies of European Union in the field of healthcare. So I think that we should try to push Prime Minister of each member states to change their mind and should have the joint competencies for health care in one part of area. So now we can only do strategy, action plan, and check if member states fill it. And if not, we can push more and more because it costs money. Our healthcare, our low prevention costs money. So it's very difficult, but I think that during conference of the future European Union, a lot of people called for changing of competencies. European Union, especially in the field of health.
And let me adapt to what Radka said. I think that, yes, the only tool that we can use in order to push towards the idea of lung protection is to create a powerful strategy on a European level. It will be something that will impact on national legislation without any implementation with any force to be implemented. But on the other way, we give the direction that we want to follow the member states. So I think for the next mandate, if we create a strategic plan for lung for the health of the lungs, it will be a good step to include all the things that we have discussed today. Because yes, the most important issue, especially for the lung, is to have a good quality of air, but also prevention.
Can I just ask you a final question, probably to you, because we are fast running out of time. Do you think, Stelios, that do you envision the results of this EU elections could indirectly impact lung health and related EU policies?
I think that the next mandate will be the mandate of health. I think that the next mandate will focus on the pillar of health. We will going to foster it, and we are going to see what will be a better communication, let me say, among member states. So it is also an opportunity for the lung to take their part on this discussion. We need to see the patient and the patient as a whole, but also we need to reduce conditions like asthma, which can be reduced in a very big way if we transform our environment in a safe place. So it's absolutely true that if we protect and make a better environment, the condition of asthma will be reduce its result. So I think that we need to focus on certain things and in order to make this kind of prevention.
Thank you very much, Stelios. And Radka, I'd like you to also reflect on the upcoming elections. What top tips would you suggest to keep lung health at the top of the agenda in the next parliament?
I hope that health completely and lung health will be priority of new elected MEPs, and I really hope so. What I can suggest is that you should very quickly attack a new MEP with this topic lung health, and so on. As I could feel from a mental health patient and a mental health organization this mandate, because we push all time European Commission for strategy or for mental health year, and we got a comprehensive approach of mental health in the European Commission. The second thing is try to set up or establish a committee for health, because it's very important, and I think that it is not good to have health together in committee, environment and consumers, because environment and consumers are really huge agenda. So I think that we need to establish really competitive, complete committee for health. So I think this is my advice for you for next mandate and for new MEP.
Thank you very much, Radka Maxova and Stelios Kimporopoulos, for your insights and your suggestions. We are approaching the end, but I just wanted to pick up on that Radka's very concrete suggestion of a way of ending the fragmentation by establishing a committee for health, and also to Stelios, who brought the idea that there should be a strategy for lung health, which would bring it to the top of political priority, and perhaps in a way would actually help improve the budget that's clearly needed and clearly insufficient at the moment. So thank you very much to the MEPs who joined us in this thought-provoking panel discussion with lots of ideas there about how to move forward, building resilience and describing the economic impact of lung health, and also the fact that better treatment of lung health and better access to care can also help remove some of those health inequalities that came to the fore during the COVID pandemic and which still exist now. And so it's and also the fact that we should lobby our MEPs. We should be, as soon as they're elected, the new MEPs, we need to be getting in there and speaking to them and telling them about why lung health is so important. And I'd also like to thank Eva Polverino from the ERS and Marcia Podesta from IFA for highlighting the disconnect between the ambition for a European health union and the cuts in health funding. One point that stays with me is that the societal cost of lung health in the EU is 422 billion euro annually. So investing in lung health would not only reduce pressure on health systems, but stimulate the EU economy. And another note is that chronic respiratory diseases are also allocated a very insufficient amount of funding. So you can find out more about the Keep Breathing campaign and the activities of the European Lung Health Group by visiting the Breathe website, where more information will be, and you go to www.breathevision.eu, as well as on X and on LinkedIn. And this also leaves me time to thank the event organizers, the European Lung Health Group, and technical support colleagues, and you, the audience, for taking part in all your questions. Thank you very much for sending them into Slido for this very lively conversation. And I would also like to thank IFA's Sustainable Corporate Partners for their unrestricted educational grants to support IFA in coordinating the work towards the Breathe Vision for 2030 and its activities, AstraZeneca, Chiesi, and Roche. So thank you all for watching. Goodbye, and keep breathing.